If you're breathing through your mouth or your child is breathing through their mouth, we have a problem. Do you know what happened 150 years ago to our country in terms of the industrialization and the United States of America?
Hey, welcome to the third season of the Dental Elements podcast. This is the podcast created for the entire dental team by your hosts, Cindy Rogers, who is a hygienist turned consultant, and with April Sluter, who is a dental assistant, consultant by day, and a brewmaster by night. Pull up that saddle stool and join us while we discuss all things dentistry. To learn more about the show, visit our website at rootyouon.com. Cheers! We have been offered a special gift for our listeners to attend a Sleep Medicine Revolution CE course in Denver, Colorado in December, the first weekend of December. We have been given 5 golden tickets to give away. So the first 5 doctors to sign up will get hotel, CE, and meals paid for courtesy of the Vivos Institute. So go to the vivosinstitute.com and use code HELLODENVER. Hello, Denver. We ran into this beautiful woman in the hall. She was the first person we met when we got to the dental festival. And it turns out she was our neighbor, our room neighbor. And then she was our captain on the Fun Quest game show as well. So fabulous lady. And I'm going to let her talk because she can talk and sing and dance. So go for it.
My name is Genevieve Poucel. I'm in Florida right now, came from Colorado, and I was a high school French teacher for 18 years. I've been working with a company called Vivos Therapeutics, located out of Denver. And we have basically a training for doctors. Do you know what happened 150 years ago to our country in terms of the industrialization and the United States of America?
Gerber?
You're close, yeah. We got 2 things. We got refrigerators, and women went to work. And a refrigerator means that we can have soft food now. We can go to the fridge and we can have yogurt and cheese and milk, and we don't have to masticate our food. And with women going to work, we left our job as breastfeeders alone. And so breastfeeders, when you breastfeed a child, you get the nutrition and you get the warm closeness, but you also train the child to breathe through his nose. So you have the tongue and the roof of the mouth working to express the milk, training that child to be a nose breather. And we've replaced that with a bottle falling into the child's mouth. And we have pacifiers, and we are not developing our airways wide, forward, and down. They're staying back. But if you go wide, forward, and down, your ear rotates a little bit, that TMJ, and then you get the airway opens up, and you're a nose breather. If you're breathing through your mouth or your child is breathing through their mouth, we have a problem. And all sorts of disease is linked to mouth breathing, including ADD, bedwetting, just as a top of that. And one more thing I wanted to say about that. We had the refrigerators, we had the breastfeeding. Oh, here's the other little ticket. We are born without a chin. If you're born with a chin, makes it even more painful to have childbirth. So you're born without a chin, and then from the age of 2 to 17, what is growing is your chin. And so we're supposed to chew food, hard food, dried meats, root vegetables, things that create your teeth. And if you think about puppies, they're chewing all the time. And even babies want to put things in their mouth. So we're supposed to grow our airway, and we're not doing it. And so along with that came crooked teeth. And crooked teeth is a sign that you're not sleeping well at night. And you're not sleeping well at night because your airway is not developed. If your child doesn't sleep through the night, you have to have that child's airway looked at.
I love it. It's so much information there. And to go back a little bit, you're talking about we're pacifying our children. We're feeding them where they don't even have to do anything. And so ironically, we're making them lazy, but lazy because they're sleepy too, because they're not getting the right sleep with oxygen to their brain because they're not breathing through their nose and they're breathing through their mouth. Right?
That's right.
And then what about the tongue being, like the frenums being tight?
Okay, so we have dentists that are educating nurses in NICU units and educating them on the importance of a tongue tie. So the tongue's position is to be suction to the roof of the mouth. That's where it's supposed to be. But if your tongue is tied, which means you have one of those tethers or something holding underneath your tongue, if you look, you can have it sort of holding you back. You're not able to latch correctly when you're breastfeeding. Breastfeeding can be painful for the mother, and you don't get enough milk when you breastfeed. So we're training a whole generation of nurses on correct handling of tongue ties and so forth. So that's the first step. Then they need to breastfeed. That's the second step. Then the third step is to give them a hard food diet. But when you breathe through your nose, you and I and all of us, when we breathe through our nose, we release a chemical gas called nitric oxide through the paranasal sinuses. This gas is called a vasodilator, which means it relaxes your arteries so the blood can flow and bring the calcium. If you don't relax your arteries, you're constricting. There's only two choices. It's either relaxed or not. And a non-relaxed vascular system is leading to a heart attack, a stroke, or can be diabetes related. These are degenerative diseases that it can create. Do you know what a person does right now if they have sleep apnea?
Take sleeping pills.
No, but what would you go to the doctors and they would say, you have sleep apnea. What are we going to do with you?
Well, usually they will do a sleep study or a CPAP machine that people can't wear, and so they just give it up, and so they continue to have apnea.
That's right. So right now that's a choice. So CPAP stands for continuous positive airway pressure. And so if you look at a child whose airway is open and who's breastfed, you'll see a big old open airway, which makes it very easy to breathe. So a CPAP would work on that person. But a CPAP doesn't work on somebody who has a constricted airway to begin with. They're not getting air anyway. So just to force it is a Band-Aid. So there's a treatment they can do with us, which is Vivos, where they would find a Vivos provider near them who would do a couple of things. They would give them a sleep study. So if they've already got a sleep study, they don't probably need that. But the other thing, and they can do it for children and adults at home, which is important, just a screening tool. And then they do a picture. A radiology can now look inside someone's airway and see it. And very often people on CPAP machines have never seen their airway, okay? So when I see somebody on a CPAP, 99.9% out of people who are on CPAPs hate them, by the way. The one guy is an exception, or they leave them behind when they go on vacation. So we can wean people off of a CPAP machine. It can be done. And they're breathing through their nose and they're releasing this and when they're sleeping. Okay, now the other choices are CPAP, surgery, very invasive. Children are having this adenoid and tonsil removal, which helps. It can grow back, but it still isn't the best solution because we could have avoided that in the beginning if they weren't mouth breathing. There's a device that some doctors will give, which is called mandible advancement device, which opens up the airway. But after a while, that can create some other effects. And then there is nothing. You could do nothing, what people are doing today. Or they could try this other approach, which is what we do. So an orthodontist, a general dentist can learn this technique. This is we're revolutionizing and shaking up the industry because we're changing it by putting something in at night and then taking it out during the day and so forth. So educating the parents, doing an appliance therapy, training the parent to really watch out for their child. We want them to become nose breathers. I got to just say to your people, if there's a person who's breathing through their mouth, they have got to see their dentist, and their dentist has got to do this new method with Vivos would be a great thing, or there's other practitioners, someone who's going to be an airway specialist. I don't just want to say my company is the only one. There's people out there who have all sorts of solutions to get you to be nose breathers. We are obligate nose breathers. Human beings are obligate nose breathers. So you should breathe through your mouth as frequently as you drink through your nose.
Exactly. You should never have your mouth open unless you're eating or talking on a podcast. Yes. And I love that. I did orofacial myofunctional therapy courses, and it was just shocking to me after being in dentistry for over 20 years. I'm like, what? Everybody needs to learn about this. It's so important. And you'll notice it everywhere once you're aware of it. And we really, really need to spread the word. There's so many little babies out there that are going to suffer, and their parents, and they could be colicky and have horrible stomachs because they're not eating the right food or learning how to chew and growing their chins. That's probably why I don't have a chin. But it's just so amazing. And you could just diagnose somebody now by walking by them.
That's right.
And if somebody's not sleeping, you're like, I know why you're not sleeping.
That's right. You can train a parent to just look. A parent knows if their child hasn't been sleeping, and that is the key. We have got to quit medicating children because they don't sleep.
Because they're hyper, right? Because they're trying to
Right.
stay awake in class, or they're afraid to go to sleep because they're
Nightmares.
dying.
Yeah, they're dying. There you go. They put children. Dr. Karen Bonnock did a research over a period of 7 years in a period of I don't know how many children, 11,000 children. She divided them into the room. Her name is Karen Bonnock. She divided them up into doesn't sleep well and sleeps okay. Of the doesn't sleep well, 51% of them were diagnosed with ADD. They put the ADD and the doesn't sleep well children in the same room. Doctors couldn't diagnose them and separate them. They didn't know which one was ADD or sleep deprived. I mean, one day of bad sleep, I'm not a very pleasant person to be around either. So day in and day out, I'm on a mission to just let every mom, dad, parent know that how your child sleeps and breathes is so crucial, and it's only going to continue through their life. And so, and also as a retired French teacher, I was a French teacher for 18 years in Colorado, and I saw so many children who were tired, high school kids, when they should be young and vibrant. Why are you so tired? And people were quickly wanted to blame the telephone, the cell phone. I'm like, I'm not sold. But then in period 5, French class, I had 20 kids and 14 were in braces and 3 needed them. Braces, crowded teeth, is a sign of a constricted airway.
Is that because your tongue's a natural retainer when you're a baby, if you can keep it to the roof of your mouth? So your bone grows around the shape of your tongue. So your tongue should fit in your mouth, right?
That's right.
Okay.
Scalloped tongue, this person's having sleep deprived issues. Grinding their teeth, guaranteed that is sleep apnea.
Yes. When I see patients, I love educating them on this stuff. And they're just like, oh my gosh, thank you. And I love getting the word out. But I want to know more about your company too.
Well, that's sweet. I mean, I'm a retired French teacher, so I feel like I'm doing this podcast and that something on here that somebody's going to go, oh, that's not possible. I'm like, okay, I've been in rooms where I've heard this discussed, so I would encourage people to go to my company's CE course. This is for dentists. It could be for hygienists. It could be for RDH, DA, or anybody who needs some CE courses. We do it Friday and Saturday, a flip-flop. Today is a Saturday. We're doing it next week, maybe Friday or the week after Saturday. I don't know. We flip-flop. And the website is, are you getting ready to write something down?
Get your pens, people.
Okay, good. So www.summitclub.dental/summit. So www.summitclub.dental/summit. And the code to get in for free would be my code. Why don't we use my code? Or, I mean, is that okay with you?
Yeah. Free is good.
Okay, mine is GVIP. And so just put in the capital GVIP, you'll get into the free summit and you'll get to hear more from a cardiologist, from some of the scientists and so forth, some of the speakers that are here today. And would love to have you get more educating on this.
Are these classes virtual then, or are they in person?
Yes,
okay.
That is virtual. Yep.
Okay, on the website. And so I'll put these in the show notes as well so people can see it if they are driving or they didn't listen and grab a pen. So,
okay, awesome.
Yeah. Can you tell us something in French before you go?
Sure, I could say something in French. Big fan of singing.
Do a little singing. That's good. We're here.
Really?
You can sing? View of the ocean. I don't sing.
Yeah. Oh, yeah. In France, right now I see a lot of boats out that window. This is a wonderful place. Here we are in Miami. I just feel so lucky to be here.
Gorgeous.
And looking out, I see, and so the best song that comes to my mind is Maman, les petits bateaux qui vont sur l'eau ont-ils des ailes?
April, hit the piano over there. Give us a couple of keys. Let's do it. Okay. It's working.
Yeah, we're here. We're in Miami. Yeah. We're looking out at the blue sea. Or there's an Il était un petit navire, il était un petit navire qui n'avait jamais navigué, qui n'avait jamais navigué. Oh, 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 That's for those French listeners out there.
That's very beautiful.
Oh, well, thank you so much. Merci beaucoup. C'était un très grand plaisir d'être avec vous aujourd'hui et merci pour votre travail pour aider toutes ces mamans.
Guess what? We have been offered a special gift for our listeners to attend a Sleep Medicine Revolution CE course in Denver, Colorado in December, the first weekend of December. We have been given 5 golden tickets to give away. So the first 5 doctors to sign up for this event in December using our golden ticket code will get hotel, CE, and meals paid for courtesy of the Vivos Institute. So go to thevivosinstitute.com and use code HELLODENVER, and you will receive hotel, CE, and meals provided for you by the Vivos Institute. the first 5 doctors to sign up. For information about this event and other courses, please go to thevivosinstitute.com and discover the sleep medicine revolution. This is very important information. I really hope everybody, every team member learns about this. It could save a life. It could save somebody you love. It could even save you. Super important information. So please, please, please pay attention to it. We will also have this information and links on our website at rootyouon.com and in the show notes. All of the information about the event and any disclaimers you will find on the vivosinstitute.com. Once again, the code is HELLODENVER, and we have been given 5 tickets to give away to 5 doctors. So please go to there and sign up for that so you can enjoy hotel, CE, and meals paid for. But most importantly, you will learn about this super important information from the Vivos Institute. To see the video footage of the podcast, subscribe to our YouTube channel at Dental Ailments, ALEMENTS podcast. To share your story, hit us up on our website at rootyouon.com, ROOTUON.com.